Our heart transplant program has been around since 1988. We've always had outstanding outcomes. One of the distinguishing features of our program is that it really is based on a team-based approach. The patient gets referred with advanced heart failure. That patient will be assessed by the cardiologist, and they will be coordinating the care involved with all the other specialists and the cardiothoracic surgeon.
Our program is unique in that every person that participates in the program has a focus on transplantation. The preoperative evaluation and the aftercare are as important and sometimes even more important than the transplant episode itself.
Once we think that the person is a potential candidate, we'll start an evaluation process in order for us to determine whether we think that transplant is a good option.
My job is to not only see patients in the clinic, but also to be the interface between the transplant coordinators and the physicians.
We see the patients sometimes at the lowest moment of their lives, even sometimes when other centers have told them no. And it's our job to evaluate them, get them up to the point of being on a wait list until the time of transplant.
We have a selection committee every week. We want to make sure we are giving the right treatment to the right patient at the right time.
And everybody provides input and everybody is able to be an advocate for the patient.
We have issues that are complex, and there is a lot of careful consideration and communication between the different disciplines.
There are patients who are on the transplant waiting list who are so sick, we use the left ventricular assist device to keep a patient alive long enough until the donor organ becomes available.
UT Southwestern, we conduct cutting-edge research, but ultimately it needs to be applied to patient care, and UT Southwestern provides that opportunity. We are doing an increasing number of multi-organ transplants. We've done multiple heart-kidney transplants, we've done heart-liver transplants. Time is of the essence for heart transplantation. So when the donor organ arrives, we can excise the old heart. Once we reestablish blood flow to the new heart, many occasions the heart just starts beating on its own. That's very rewarding when you see that happen.
After transplant, patients are on immunosuppression. And one of the really beautiful things about working at UT Southwestern is that we have specialists who can address any other medical conditions that may come into play after the heart transplant.
We're there to ensure that the patient not only has a successful outcome physically, but we're also there to encourage them and support them emotionally.
It is truly a very meaningful experience to be in this environment.
And you feel that when you come here, you'll know that people really care about you, really trying to do what's best for you.
The most rewarding part of my job is when I see a patient once they've been transplanted and I see them doing well. And I feel like all of us play a role in that.
Although our brain defines us, most of us feel like the heart is the seat of the soul, and it's a privilege and patients trust you to take care of their heart.
And what better way could you help a person than someone who has end-stage heart failure, who can't do anything, restore them to a normal quality of life, all because of the transplant, and really at the end of the day, all because that donor was willing to give that gift of life to let this other person be restored to life. And so that really is an amazing opportunity for all of us on our transplant team to participate in this field.